Here to discuss what comes next for the former president is CBS News medical contributor Dr. Celine Gounder. She's editor-at-large for public health at KFF Health News. Celine, very good to have you here on this particular day because you hear the words aggressive, stage 4, metastasized to the bones. It sounds very dire. Is it as serious as it sounds?
Look, this is a very serious, aggressive cancer. So he has a Gleason stage of 9 out of 10, with 10 being the worst. So that tells you about the aggressiveness of the cell type that we're talking about here, the type of prostate cancer he has. There's been spread to the bones, which by definition means it is metastatic. But the good news in terms of what we've been told so far is that it is hormone responsive.
What does that mean?
Which means,
Well, testosterone fuels the growth of the prostate cancer. So if you can block the testosterone, you're slowing, you're blocking the growth, and that is a very good prognostic indicator. So you have some bad news, but there is a silver lining there.
But you have this thing spread to the bones. How long does that take? We hear that he was just diagnosed last week. Does it spread to the bones very quickly? I always thought it took a while to do that. Wouldn't he be getting regular checkups?
Yeah, so it depends on the kind of cancer you're talking about here. We do know it's quite aggressive again. So the time in which it would take to spread to the bones is going to be shorter than with a less aggressive cancer. And he's 82. Normally, doctors will stop screening for prostate cancer at 75 or so, because after that, the prostate cancers you typically pick up are very slow growing. And so the harms of all of the testing and treatment for something that may not kill you, you're talking about risk versus benefit, it may not be worth the risk.
Isn't there a blood test that men can take to know if they have an issue that might warrant further examination?
So there's something that we call a PSA test, but that can also be indicative of many different things. It could just be you have an enlarged prostate. Maybe you have a low-grade infection in the prostate. There are many things that can cause that, and so this is, again, why after a certain age, doctors will typically stop screening for prostate cancer.
Wow.
But in his case, it's not screening. It's important to emphasize this was diagnostic because he had urinary symptoms, and so there was a reason to do more testing.
Quickly, what is your final message to men of a certain age?
Well, men of a certain age, you need to be seeing your primary care doctor for regular exams, and it's not just for prostate cancer, right? It's to check your blood pressure. Do you have diabetes? Do you have, have you gotten your colonoscopy for colon cancer?
Health and wellness check.
Exactly.
But if you're 75 and up, they wouldn't check for prostate cancer anyway.
Not
unless you
normally.
had symptoms.
But he had symptoms, and that's why they did the testing.
All right, Dr. Gounder, thank you so much. Important information, and we will stay tuned on what's happening with our former president.